Is October 1, 2020. We're here with Gerardo.
Yes, or Jerry.
Or Jerry, thank you. And I have your permission to video you and post you?
You do.
Thank you very much. Jerry hurt his back. How long ago?
2 years ago.
And your back was really bad. It laid you up. You were
Really bad.
basically in bed for a week. You eventually went and had PRP, platelet-rich plasma,
Correct.
injected. The first session was $3,500, correct?
Mm-hmm.
And the second session was $3,000.
Correct.
And they did a ton of injections, like 20 plus injections.
Correct.
And you were sore, real sore afterwards.
For a
it took
week.
days,
Yeah,
for a week.
For a week.
And then afterwards, you gradually got better. You didn't get better after the first one,
No.
after the second one.
Yeah.
So that's $6,500 and a lot of agony,
Yeah.
a lot of shots.
Yeah.
You've come to me for Ozone. You just had your first one. How did this compare?
Oh, like night and day. Just night and day. The comparison, yeah.
No problems with this one, correct?
No.
It was
nothing.
easy, very easy to tolerate.
Simple. Yeah.
Okay. And with the PRP, it took weeks to get better.
Correct.
Correct?
Yes.
Now, admittedly, you did not have a lot of pain when you came in, but you had some. So what has happened to you since I did the injection?
I just feel a lot better. I mean, I could twist back and forth.
You can twist, and you were just doing jumping jacks.
Yeah.
And you
Yes,
couldn't
I
do
would.
that before?
Yeah.
Okay. And if you recall, this muscle here was weak.
Correct.
When you took your hip out in this direction, that's called abduction,
Yeah.
I could very easily push it back to the midline,
Correct.
right?
Yeah.
You couldn't resist
I
me.
didn't have no strength at all.
What happened after the injection?
I had my strength back. You couldn't.
I couldn't budge it.
Yeah, that's the word. Yeah.
Right? I couldn't budge it. Your leg should be stronger than my arms.
Yeah.
It should be, and it was. And I couldn't bring your leg back to the middle. Did that
Correct.
surprise you?
Yeah, it did. It did really surprise me how
Okay.
I got that strength back. You know.
Okay.
Yes.
Now, what if I tell you, compared to $3,500 that you paid, what I just did to you on, and not on the first visit, it's cheaper the first visit, but on a subsequent visit, what I just did to you is $260
Wow, that's.
compared to $3,500.
I wish I would have came here first.
Less than 1/10 of
Yes.
what you paid, right?
Yes.
Okay.
Yeah.
Thank you very much. Thank you
You're
for
wel-
letting me post.
Thank you. Thank you, doctor.
Thanks. Jerry, one other thing. I talked to you and beat you over the head with a wet noodle
Yes.
about
My overweight.
you're overweight.
Hmm.
What are your thoughts or comments on how I approached you with this?
I appreciate you for rebuking me, and I just felt like only a friend would do that, and I feel like you're a doctor, but not just a doctor, but a friend that cares.
Thank you.
And I really appreciate the correction, and I needed that.
No other doctor has talked to you like
No.
this before, right?
None.
And
Never.
You used the term rebuke. I did not make you feel small
No,
or
not at all.
inferior or anything else, right?
Like a friend.
Like a friend,
You know, corrected me like a friend.
right?
That's how I felt.
And you told me this was one of just that alone was worth the visit.
Exactly. And if you weren't going to give me shots or anything, just that alone was going to be worth it.
Okay.
Yes.
Thank you very
Oh,
much.
thank you.
We not only talked about your weight and what it does to you, we talked about how to fix it. You want to comment to the viewer about
Yes.
what we did?
If God didn't make it, don't eat it.
Good.
Yes.
Remember.
Yes.
That's the most important thing. God did not make the starches we eat, the breads we eat, the pastas we eat. God did not make fried foods.
Exactly.
And that was the advice that I gave you.
Yes.
And no one has given that to you.
Nobody.
Okay.
And no doctors ever gave me that before. And I really appreciate it. And thank you so much, doctor.
You're welcome. Thank you for coming in.
Oh, thank you.